Hello, this is Dr. Nanavati. Thank you so much for joining me today. The other day, a patient called me. He was worried about his neighbor who was increasingly short of breath. So he wanted to ask me what symptoms and what signs should he be looking for to determine if this person had heart failure. So that's a great question. And actually, let me elaborate a little bit on this. Heart failure can be manifested by signs and symptoms of forward heart failure and backward heart failure. This is obviously a simplistic approach, but it allows us to understand the basic pathophysiology of heart failure. When we talk about heart failure, there's several different types. There's heart failure with preserved ejection fraction and heart failure with reduced ejection fraction. Heart failure with reduced ejection fraction is the typical term that we use when we say somebody's in heart failure. Somebody can get short of breath, and usually it is due to reduced heart function. So the contraction of the heart usually contracts. So when it contracts not just like this, but it also contracts with a torsion, with a little bit of a torsion like this. So when the contractility of the heart is compromised, that causes heart failure with reduced ejection fraction. So what is ejection fraction? Ejection fraction is the fraction of blood that is ejected out of the left ventricle into the aorta. So the amount of blood that was initially in the left ventricle, there's a fraction of that is ejected into the aorta. The usual fraction is about 50%, 50 to 60% of the blood is ejected into the aorta to the rest of the body to supply blood supply to the rest of the body. When the ejection fraction falls below 50%, then the contractility of the heart is compromised. So the symptoms of heart failure can be simplistically looked at as forward heart failure and backward heart failure. So what do I mean by that? Let's look at backward heart failure. So when you have backward heart failure, I'm going to show you this diagram that I made, and it's simplistic, so please bear with me. So you have the left ventricle and the right ventricle. Usually when the left ventricle is not pumping adequately, so less than 50%, then what happens is the blood backs up into the lungs. So it goes into the left atrium. Usually what happens is the blood gets oxygenated and then gets emptied from the pulmonary vein into the left atrium, into the left ventricle, and then pumped out the aorta to the rest of the body, okay? So what happens when there's heart failure, the forward pumping is not there. So there's the blood backs up into the lungs. So when the blood backs up into the lungs, that causes shortness of breath or congestion. So you feel like you can't breathe. So symptoms like, okay, I have to wake up in the middle of the night, or I have to get the windows open so I can breathe better, or I can't breathe lying down flat, and I need several pillows to prop me up in order to breathe. That's typical of left heart failure when we call backward heart failure. So now when you look at the most common cause of right heart failure, it's usually left heart failure itself. So when you have left heart failure and it continues with backward failure, then the blood backs up into the lungs and then backs up into the pulmonary veins and then into the right atrium, and so into the right ventricle and right atrium. So then what happens is the blood then gets the ejection of the right ventricular ejection is compromised. When the right ventricular ejection is compromised, then the blood backs up into the inferior vena cava. So this is the inferior vena cava, and the inferior vena cava is connected to the liver, and it's connected to the kidneys and to the lower extremities. So when you get right heart failure, that means the right heart is not, the function is compromised. Then you'll get liver congestion. So your eyes will turn jaundiced. Your skin may turn jaundiced. You'll get tenderness on the right subcostal area. And then the kidneys get congested. That's a more newer concept of venous kidney congestion. And the lower extremities become edematous or swollen. So you get swollen extremities. That's going to cause, that may be due to right heart failure. So these are the two components. So right heart failure and left heart failure, mostly because of backward heart failure. So it's a problem of the flow is not pumping forward. So it's the blood is then progressing retrograde in backward, where it should be going forward, right? So that is what we call backward heart failure. Now I'm going to talk to you about forward heart failure. So signs and symptoms of forward heart failure. So let's talk about heart failure in terms of forward heart failure. So when I talk about forward heart failure, that means the contractility of the heart has now become so compromised that the forward ejection of blood into the aorta is now affected. So there's actually not enough blood being ejected into the aorta, and then those organs that are being perfused by the heart are not getting enough blood. So what happens? So let's go and discuss that a little bit. So in this diagram, I'm just isolating the left ventricle. I'm not showing the right ventricle. So the left ventricle, when the pump function is so compromised, it then, as the blood gets ejected into the aorta, into the carotid arteries provide blood to the brain, and then the gastroepiploic artery provides blood to the stomach. And then if you look here, then you get the superior mesenteric artery providing blood to the bowels and the small intestine, and then the renal arteries provide blood to the kidneys, and then the iliacs go into the lower extremities. So when you look at what symptoms are characteristic of forward heart failure, it would be reduction in flow to these organs. So let's just talk about it. So when there's reduced flow to the brain, then it is manifested as brain fog or lightheadedness, dizziness, and also in extreme cases, reduced cognition and awareness. Then when there's reduced flow to the stomach, then you have trouble digesting food. Okay, so you're getting a stomach ache. And then when there's a reduced flow into the bowels, where the blood flow to the bowels are reduced, then you get a stomach ache when you eat. So after you eat, you get a bloating or a ache in your stomach right after you eat. This is classic for reduced heart function. And then there's when there's reduced flow to the kidneys, that causes kidney compromise in the kidney circulation, and that reduces the function of the kidneys. So then you can have reduced urine production. And then finally, when you have blood flow is reduced to the lower extremities, then the lower extremities and the upper extremities later feel cool and clammy. So these are kind of the symptoms that would be characteristic of forward heart failure. In this video, I discussed forward heart failure and backward heart failure and the symptoms related to both. Now, if you or your loved one has any of these symptoms, then please go to your physician right away, because prompt diagnosis and treatment is necessary so that we can reduce the symptoms, improve your lifespan, and improve your lifestyle so that you can do all the activities that you want to do without limitations. It's really important to get to your physician right away. I can't understate this enough. So please, if you have any of these symptoms, do not wait. Go to your doctor and get it addressed. Thank you again for visiting today. And if you have any questions, please visit my website at HeartCare4Life.com. Thank you again for visiting.